So when I came into my role, change had already happened as part of the traditional daycare service model. So I came in at quite a significant time. And I got to sort of about 18 months and I was sort of hit a period of, I suppose, what people refer to as stuckness. I wasn't quite sure where we were going with the service. I felt I needed a bit of guidance, a bit of support in order sort of to continue improving and developing what we were already doing. We were doing quite well. And I felt I needed to bring the team with me as well, because some of the team had been here for a very long time. They had seen some of that change occur, but it very much, as historically with a lot of their services, it come down from above really. You were just told this is what's going to happen. And they didn't feel engaged, they didn't feel part of it. So then with the support of Dr. Daniels and other sort of external services, I started to learn a bit more about sort of quality improvement and the methodologies that come as part of that. Again, I'd heard about it sort of through parts of my career, never really took a lot of notice because I'm sort of very much a very clinical, very much a hands-on nurse. So we started to try to sort of drill down to what the problem was. But again, it became sort of quite, I saw it as something quite huge and I just felt I was sort of really struggling with it. So then by using some of the methodologies, using actually getting patients engaged in what we were doing, carers engaged in what we were doing, actually getting them involved in what they felt maybe the problem was, even then to them there wasn't a problem, but just sort of a bit of further exploration of them and also other health professionals as well that were our sort of key stakeholders. And so just using then methodologies of like process mapping, it's about bringing sort of teams and other health professionals together, shared learning experience. I myself personally found the whole experience very engaging. It helped engage the team and bring the team with me, whereas before they were sort of on the sidelines. It was quite empowering as well, knowing that you have these processes that you could use to help shape and model your service and improve that patient experience, which again was very, very rewarding. And it was very sort of confidence building as well for myself in my role. And I think for members of more the junior staff, because for them, in order to see that, because a lot of the problems were quite big, once we started using the methodologies and we were able to break that problem down into something that's more easily manageable and measurable, and they could actually see that those small changes were actually making quite a significant difference to that patient experience. So the impact on the way it sort of had that sort of ripple effect across the organisation is that as part of what we were doing, we sort of presented to some of our education sessions and to some of the trustee events as well. And for people that are representing other teams there, they were able to see because one of the biggest positive results that we had was that we actually reduced our waiting time by half of people that were waiting from the time we received a referral to when they were first contacted. As part of that baseline data that we had gathered, we saw that some people were waiting up to sort of 20, 21 days, which people with that limited life expectancy, that is a long time. So with the improvements that we made, and they were just small improvements, we were actually able to reduce that waiting time by half. So when other teams could say, hang on, what they're using, it's making a difference. It's making a difference to the patient experience. It's something positive. And we could actually say, well, listen, you may think it's quite onerous. They felt brave enough, I think, to take that step and actually utilise it within their own service. So it's about shared learning, it's about shared experiences, because we're all striving towards the one thing, to ensure that it's a positive experience for the patient and their carer and the family. To them, it was very rewarding. They felt empowered. They felt that they could actually make a change, they could make a difference. And we've continued to use those methodologies and sort of as a way of going forward. We've continued with some of the service user involvement. The challenge we have with obviously patients and carers, that the nature of the client group we have, their interaction might be quite brief. But I think for patients who are involved and carers, they felt very, as if they were given something back. They felt very valued, and they felt quite sort of, they had like quite a significant part in what we were doing and sort of shaping the service going forward. So I feel it's been a huge benefit to us, certainly as a team, and I think to the organisation as well, because we were the pilot area for those more that more significant involvement with a lot of the sort of QI methodologies, with the process mapping, patient involvement, stakeholder events. So once they could see that what was happening in our area, that's that's really working quite well. I can see it's making a difference there. Then they felt brave, I suppose, to take that step themselves and not see it as really sort of onerous and sort of arduous, and just about shared learning and sort of shared experience.